So, as I said, a couple of weeks ago, we had 5 women who had surgery together, and they had a great experience. They got to be good friends. They were laughing and joking. But at their Tuesday clinic, where they returned to get their staples out, 2 of them had what they said was constructive criticism. They felt a little at sea, a little anxious during the day today, not because of the events, but because they weren't sure what was happening next. And so they thought and asked me, you would help future patients if you take a few minutes and kind of explain exactly what happens today and tomorrow so that you can be clear on that. So that's what we're going to do this morning to start off with, is just tell you. First of all, this morning's discussion should remind you a lot of yesterday. We got the cameras and we got the people in a group, and we're in fact repeating yesterday all over again. Our goal is to spend time with you. Remember that many of you come from far away. We don't have the wonderful opportunity to see you 3, 4, 5, or 6 times ahead of time. And so that's a disappointment to us. It's not something we like. So while you're here, we want to spend as much time with you and talk with you as much as we can. Because some people are in the mood of, okay, I put up with the packet, Dr. Rutledge. I sat through that clinic yesterday, but let's get going. And so I understand that feeling, but I want to apologize to you and say you might as well relax because we ain't going anywhere. And the idea behind that is I need to work on our doctor-patient relationship. I don't have as much time with you as I would like, but I have you now and you're not going anywhere. Of me getting to know you better, of me re-emphasizing to you my personal commitment to your health and well-being now, today, and forever. And that's obviously a big responsibility. It's one that I take very seriously, and we don't want to give this doctor-patient relationship, this commitment that I make to you and the commitment you make to me to follow our instructions to take good care of yourself, we don't want to take those things lightly. So again this morning, we are going to spend time talking. We are going to try and go through things and answer questions, but either way, we're going to be here. So even if no one has any questions, we're going to be here. Don't worry, I can think of things to talk about, but we're going to be here for a while. And that's because of my belief that we need to work on that commitment, that doctor-patient relationship, my emphasis on my availability to you. So this next thing I need to apologize to you for is some of you are going to go first and some will go last. And that's disappointing for those of you who go last because you sometimes want to get over there and get first, and sometimes we'll get telephone calls and say, hey, let me go first. And we don't do that because our thought is there's a tremendous value of you sitting here in this group this morning. Now, some people are kind of shy and don't want to do this, but we've been doing it this way for 10 years, and we can tell you that the people that you're here with this morning, you have the potential to get to know, you have the potential to see upstairs, and when you have a deep breath and a cough and it hurts here, or it feels this or feels that, those people that are now strangers can become friends and helpful people to get you through this so that you can know all of a sudden, oh yeah, I have that pain too. Or we've had little people take on responsibility and they say, you know, you're not walking. And you know, somebody's in the, what? And people come into other people's rooms and come on, you have to get up and walk. You know, what? Get out of my room, you know. And they build this relationship which in some ways can be intrusive. But we have had 100% of patients appreciate and participate in this group setting. And when we ask and canvass our patients over and over again, they have found this useful and valuable and helpful in recovery. So we need to talk a little bit about that. I need to apologize that I'm kind of throwing you into that. In other words, all the other group here, you don't know one another yet, but we want you to. And we think that if you can look around this room and look at one another, you've all gone through the same things. You've all suffered through the difficulty of trying to lose weight and failing, and the comments from other people and things like that. And we're all really together in that community this morning, and we've found that that community approach is tremendously valuable. And we hope that you will find that a positive experience also. to get that positive experience, to be part of this community, this little community this morning, and the larger community of the mini-gastric bypass patients, we have to have all of you here together this morning, again. And so that means that some of you will end up waiting till later in the day to have your surgery. Again, we apologize about that delay, but we think overall the benefits outweigh the disadvantages. Now what, again, we're going to do this morning then is, first of all, apologize about the delay, explain what we're going to do, and our first patient this morning, whose chart we don't have yet, we will take to the operating room. The operation itself takes about 30 to 40 minutes on average. At the end of that surgery, I'll come out and find the rest of the group, report in how your surgery has gone, and then we'll take the next person. The person who's had the surgery will come out to the recovery room. I'll come out and find the support folks and chat with each of you and say how the surgery has gone. You'll be waiting down by the elevators down this way where you came up, and I'll chat with you for a few minutes, explain that the patient will be in the recovery room for about an hour or two while the anesthesia wears off, and then go to the 4th floor sometime an hour or two after you and I chat. On the 4th floor, you'll be there with nurses, many of whom have had the surgery, and so they'll have good insight into what you're going through. You'll basically be asked to do a couple of things, which is sometimes walk a little bit, sometimes drink and sip a little bit, and sometimes take a little medicines. Nothing is necessary. You don't have to walk if you don't feel like it for a few hours. You don't have to take any of the medicines if you don't feel like it. Sometimes the oral medicines can be bothersome, so skip a dose. Sometimes the nurses will bring in a high number of pills all at once, and so we would like to warn you, don't try and take them all at once. Just relax, take one at a time, and take it slow and easy. Post-operatively, one of the complications you may face is some pain or discomfort. That usually is very minor. So if you think of the patients of mine that you've talked to, did they say they had a lot of pain? Yeah. Most people like too many sit-ups, or they'd been to the gym and pulled a muscle or a Charlie horse. But if you do have pain, we have 3 pain medicines ready and set up for you to manage your pain. And we want to tell you about that. First, you're going to have an IV pump with a button so that you can give yourself your own pain medicine. Okay? That's called a patient-controlled analgesia, so that you can give yourself your own pain medicine. Now, if you think about it, if I'm going to give out narcotics in a little pump to people, I have to be pretty careful about that. So we give you a pretty low dose. So don't hesitate about using it. We have to give it in a low dose because, as I kind of kidded around about that yesterday, I said, I work with the public, and so I have a couple of funny stories about the public using my PCA pump. So one morning I came in and a husband was pushing the pump like this, saying she was kind of bothering me. Came in another morning and a woman was in bed holding the PCA pump button, and I said, "How are you?" She said, "Just terrible." And I said, "What's wrong?" She said, "I have to go to the bathroom, and every time I call the nurse..." So she'd been the whole night, and she really felt she needed to go. And she was calling the nurse with all she could, but it was the wrong button. So the nurse didn't know, and so she'd been several hours. And of course, as she got sedated, it was even harder. Anyway, so remember that we have intentionally armed the PCA pumps with a small dose of dilaudid narcotics. So don't hesitate to use that if you have any discomfort. But because it's small, we have another backup dose of the powerful intravenous narcotic called dilaudid. Dilaudid is a special kind of narcotic because it has a known side effect of causing euphoria, happiness. So again, if you have some pain post-op, don't hesitate to try a little happiness. You're only going to get it for a day, so don't worry about it. Some people worry about addiction potential and things like that, and small doses of narcotics have very little addiction potential, but we don't want you to hurt. And then in addition to that, we have tablets of narcotics that you can take as well. So we are pretty well prepared for any kinds and levels of pain. If those things don't control things well and completely, please remember that you can call me anytime, day or night.